Hi friends, welcome to the channel The Nurse. Here we are discussing about community health nursing MCQs with the rationales. So in community health nursing, it is a vast subject. So I have selected three topics: epidemiology, IEC, and vaccine-preventable diseases. So we will move to our topic. Before that, if you are not subscribed to our channel, please subscribe. So we will move to our topic: community health nursing MCQs with their rationales. First question: which of the following best describes an endemic disease? A disease that occurs occasionally and at irregular intervals, a disease that spreads rapidly across countries or continents, a disease that is constantly present in a particular geographic area, a disease outbreak that affects a large number of people in a community suddenly. So, endemic disease, you need to think about endemic disease. So here I have given options, confusing type. So if you know the definition, you can easily answer here. Correct answer is option C, a disease that is constantly present in a particular geographic area. So we will see the definition. An endemic disease is constantly present in a specific population or a particular region. So some characteristics are there for endemic disease. First one is it maintains a stable incidence over time. So there will be a stable number of cases over a period of time. Does not require external introduction. So there is no, the organism will be present in that particular area. There is no need for entry of external entry. It may show seasonal variations. So some rainy season it may have more numbers, or sometimes summer season may have more numbers. So it will depends on seasonal, and the rate of incidence will be changed. For an example, malaria is endemic in tropical regions with predictable annual case numbers. So for an example, if number of predictable number is increased, that will change into epidemic. If it is a stable number of cases, means that will termed as endemic. If number is increases more than that expected rate, then it will call epidemic. We will see in next question. A sudden increase in the number of measles case in a town is an example of endemic, sporadic, epidemic, pandemic. Correct answer is epidemic. So we have discussed about epidemic. So a sudden increase in the number of measles case in a town is an example of epidemic. A constant presence means that will be endemic. Sudden increase in the number, that will termed as epidemic. We will see the definition. An epidemic is a sudden rise in a cases in a particular area. There are some key points in epidemic. It exceeds expected baseline rate for that population or that particular area. Often it implies communicable disease. Usually epidemic implies communicable disease, that is cholera, influenza, mumps, measles, etc. So these are the epidemic disease examples, that is communicable disease. Sometimes the epidemic become pandemic. It may spread globally throughout the countries. Next question: which of the following disease is the best example of a pandemic? Cholera in one village, swine flu spreading globally in 2009, chickenpox cases in a school, a few cases of rabies in a district. So here example, that swine flu spreading globally in 2009, that is an example of pandemic disease. So can you comment another example of pandemic disease that is happened in 2019 and 20? Okay. So a pandemic spreads across countries or continents. Like 2009 H1N1 outbreak, there is also COVID-19 outbreak in 2020. It is started in 2019 in China. Then the main spread, it is become pandemic, that is happened in 2020. Worldwide spread. Another key feature of pandemic means there is a worldwide spread will be there, and it has to be announced as pandemic by WHO. Then only it will consider as a pandemic disease. There will be high attack rates across all the regions. So pandemic cases that will spread countries to country or continents to continents. There will be a worldwide spread. WHO to be declared it as it is a pandemic disease. Then only we can consider pandemic. Then the rate of attack will be very high. Fifth question, which term describes a disease that occurs infrequently and irregularly in a population? Pandemic, endemic, epidemic, sporadic. So we have discussed pandemic, endemic, epidemic. So you can easily answer. The most possible answer will be sporadic. So correct answer is sporadic. Sporadic means a disease that occurs infrequently and irregularly in a population. So we cannot control and we cannot expect this only this number of cases will be there. But the rate of incidence will be vary. Occasional irregular occurrence of a disease with no discernible pattern or predictable frequency. That is a peculiar feature of sporadic disease. With no discernible pattern or predictable frequency. There will be isolated cases unrelated in time or places. So it may not depends on season, or it may not depends on region wise. There will be isolated cases here and there. No ongoing transmission chain. So usually the community health nurse or the healthcare persons cannot identify the transmission chain. Unidentified transmission chain will be there. May represent zoonotic or environmental exposures. So there will be some exposure, that possible exposure with zoonotic or environmental exposures. Sometimes birds or animals may spread this disease, but there will not be a specific information regarding that exposures. Sporadic cases of leptospirus occurs in farmers after flooding events. So after the flood events, there is a chance of leptospirosis in farmers. That is a example of sporadic disease. We cannot predict the number or incidence rate. Sixth question, malaria is a consistently present in a certain parts of Africa. This is an example of sporadic, endemic, epidemic, pandemic. So after learning these many terms, so you can answer here. The correct answer is endemic. So consistently present means that will leads to answer endemic. There will be increase the number of incidents means epidemic. Sporadic means there will be occasional occurrence of disease here and there. Pandemic means worldwide spread. Endemic diseases are consistently present in a specific areas. So we already learned. Seventh question, what is the primary goal of IEC strategies in community health nursing? IEC strategy means IEC represents information, education and communication. As a short form, it known as IEC strategies. Options are to provide curative medical treatment, to replace clinical healthcare services, to promote health awareness and behavior change, to focus only on individual patient care. The main goal of IEC strategy, that is to promote health awareness and behavior change. So earlier the strategy was only the passing of information, but nowadays the thing is the earlier strategy is changed into IEC because there should be a behavior changes also should happen after the information after passing the information. So that is a main focus of the IEC strategy to promote health awareness and behavior change. The main objective of IEC or Information Education Communication is to educate communities, raise awareness, and encourage positive health behaviors rather than just providing a treatment or information. Which of the following is an example of an interpersonal communication method in IEC? Radio advertisement, health posters, door-to-door counseling by nurses, social media campaigns. So here the key word is interpersonal communication. So correct answer here, door-to-door counseling by nurses is a interpersonal communication method in IEC. There is another method also. Interpersonal communication involves direct interactions. Then door-to-door visit means there will be a direct interactions, or other example is counseling. During counseling there will be a direct interaction. So these are the interpersonal communications in IEC strategies, while mass media like radio, posters, social media is a non-personal communication. So I think it is clear. We will move to next question. Which factor is most important for effective IEC material design? Use of complex medical terminology, cultural relevance and simplicity, high printing cost, availability in only one language. Correct answer is option B, cultural relevance and simplicity. IEC materials must be culturally appropriate, simple and in local language to ensure community understanding and engagement. So we need to plan according to the knowledge level of community. We need to plan and we need to provide information in their local languages. It should be simple and culturally appropriate. So what are the cultural practices we should know? Then only we need to plan. So it should be culturally appropriate, simple and local in local language. 10th question. In community health programs, IEC is essential for only treating infectious diseases, strengthening preventive healthcare, replacing doctors in rural areas, reducing the need for vaccination. Correct answer here, strengthening preventive healthcare. In community health program, IEC essential for strengthening preventive healthcare. IEC primarily focuses on preventive healthcare, that is hygiene, family planning, immunization awareness, etc., rather than just a treatment. 11th question. Which of the following diseases is not typically prevented by routine childhood vaccination? Measles, polio, malaria, hepatitis B. So correct answer is malaria. So malaria is prevented primarily through vector controls, that is mosquito nets, insecticides, etc. And anti-malarial drugs are available. Usually there is no proper vaccine for malaria, but some medicines can be temporarily prevent this malaria through an experimental that is what experimental malaria vaccine still exists, but it will not provide a permanent immunization against malaria. Measles, polio, hepatitis B are part of standard immunization schedule. Example MMR, OPV, IPV or hepatitis B vaccines. The MMR vaccine protects against all except, easy question, mumps, measles, rubella, rotavirus. So if you understand the full form of MMR, you can easily answer here. So correct answer is rotavirus. MMR means it will protect against mumps, measles and rubella. The MMR vaccine covers measles, mumps and rubella. Rotavirus is a separate vaccine given orally to prevent diarrheal disease, but it is not included in immunization schedule in most of the countries. But in some countries, it will give as a part of routine immunization. 13th question. Which vaccine preventable disease can cause lockjaw due to toxin-induced muscle spasm? Pertussis, tetanus, diphtheria, influenza. So lockjaw is a characteristic feature of tetanus. In tetanus that is caused by Clostridium tetanus, it leads to trismus or other name lockjaw, and there will be a severe muscle rigidity. The DTAP or Tdap vaccine includes tetanus toxoid for prevention. So DTAP, that is common DTP vaccine or DPT vaccine. So that is given during our immunization schedule, and after at the age of 9 or 10 there will be a booster dose with the Tdap vaccines. So that will give a longer period of immunity against tetanus. Herd immunity is most effective for which type of disease? Non-communicable, example diabetes; highly contagious, example measles; genetic disorders, example sickle cell anemia; autoimmune conditions, example lupus erythematosus. Correct answer, highly contagious disease. So herd immunity means there will be an immunity against a particular communicable disease in that particular region. Most of the people, they got immunity against that particular disease either due to mass vaccination or due to attack of that particular infection. Then later they will get a immunity. Herd immunity, or it is also known as population immunity. So which immunity is known as population immunity? Herd immunity. It occurs when a large population of a community becomes immune to a disease that may be through vaccination or prior infection. It indirectly protecting unprotected individuals by interrupting transmission chains. So there will be a the majority of people have that immunity. So unprotected individuals, those who are not having that immunity, will not get it from that particular area. If they are going outside from that particular area, they may expose that infection and they may get. But during the area or their range, they will not expose to that kind of communicable disease. Herd immunity works best for contagious disease, examples measles or polio, by reducing the transmission when most of the population is vaccinated or exposed to prior infection. Non-communicable diseases are not spread person to person. That is why it is known as non-communicable disease. 15th question. Why is the BCG vaccine given at birth in TB endemic countries? To prevent pulmonary TB in adults, to reduce severe childhood TB, to replace antibiotic treatment for TB, to cure latent TB infection. So correct answer is to reduce severe childhood TB. BCG vaccine will not prevent TB at later stage of life. Usually it is used to prevent the severe childhood TB. Also tubercular meningitis. The BCG vaccine is most effective against severe pediatric tuberculosis, example miliary TB or tubercular meningitis or TBM. It has limited efficacy against adult pulmonary TB. So it is usually effective in childhood time and it has limited efficacy against adult pulmonary TB. So what is miliary TB? Can you explain here? So you can comment it below. So I will explain briefly. Miliary TB is a disseminated form of tuberculosis. Disseminated means spreading everywhere. Characterized by widespread hematogenous spread. Hematogenous spread means spread through blood. of Mycobacterium tuberculosis. Mycobacterium tuberculosis is the organism causing tuberculosis, leading to tiny millet-sized lesions. So the miliary TB, that Mycobacterium tuberculosis spread all over the body, and it will leads to millet seed-sized lesions in multiple organs. That is lungs, liver, spleen, brain, etc. So that is miliary TB. So that is about today's video. So thank you for watching this video. Please like and share with your friends, and don't forget to subscribe our channel, The Nurse. Thank you. And also, if you have any doubt means, you can ask in comment section. Thank you. We will make another video on pediatric nursing or child health nursing.